some people said, yes, there's risks of estrogen and progesterone in treatment of menopause, but there's risks in not using them in treatment of menopause. What was your read on that one?
Well, there's risk in not using them. Well, I'd like to know what risks there are in not using them. The risk of maybe having iron deficiency anemia because of heavy bleeding, yeah, that could be a risk. But let's correct the underlying estrogen dominant program, and you won't lead down that pathway to that. But the risks are much more severe and significant using Premarin and progestins, which is synthetic progestins, that wouldn't even compare to some of the minor things that may happen if they don't use it. Now, we have to realize that a long time ago when women had hysterectomies, they would put women on estrogen for what reason? That was to help slow down bone loss so they didn't get osteoporosis, okay? But, you know, there's other things that play in the role of osteoporosis, and estrogen alone is not going to stop you from getting osteoporosis.
What do you think about the concept of bioidentical hormone replacement? What's the difference between bioidentical and anything else?
Well, bioidentical hormones are really hormones that are made from plants, and basically they use the term bioidentical, but when you look at the chemical structure, I don't personally think they're, quote, bioidentical, but that's the catch-all phrase, so I'm going to go along with it at this stage.
In this case, it was yams.
Yeah, well, you use phytoestrogens, which are plant estrogens, and they have a very similar molecular structure and biochemical structure of what human hormones are. Now, if you take a look at the synthetic hormones, that is totally different than a human hormone. In fact, most of the estrogen replacement therapy comes from horse urine, which they call pre-mare urine, Premarin, and that's where they hence got the name from. But we have to realize that these bioidentical hormones are very good, and a lot of people have read Suzanne Sommer book out there, The Sexy Years. Of course, I read the book. I never thought I'd be reading that book, but I had to because all my patients were reading it. And we have to realize that bioidentical hormones are the hormones that are made from plants, and they have less side effects. But the problem with them is that the pharmaceutical companies cannot patent a plant, and so the profits aren't there. So sometimes they like to downplay that. And in fact, we know that Premarin dropped, I think, about $70 million in sales after bioidentical hormones came out. So they're not too happy about that. In fact, they're trying to make bioidentical hormones almost a prescription, from what I've been told.
And of course, it's a given that we haven't had someone on the show to speak on the drug company's behalf, and I'm sure that they have many pieces of information and perspectives that would help illuminate this in more detail, and we certainly don't want to cast aspersions on any group on the show, but we're giving Doctor his chance to say what he believes. It's got to be a tough time to be a woman, because here you are, I mean, you read a bunch of stuff a year ago that says that it's very dangerous, and then there's a retraction of half of those statements, and now there's, I mean, what is a woman to think when it comes to the idea of hormone replacement therapy? I mean, what's the advice you'd give her?
Well, the advice I give them is to read the study. Some of the things that were taken away from the initial reports that came out are basically being broadcast by the media. And those things, in my opinion, can be twisted and tilted. We have to realize that, you know, the pharmaceutical industry spends billions of dollars on advertising, and some of them, you know, the advertising dollars are spent on different shows, so they get a little different twist. But the average woman needs to understand this. There is help out there for them. You do not have to live the way you're living. You know, I've had husbands actually come into my office and thank me for giving them their wife back, because that's the person they marry. Hormonal imbalance is really, it can cause major problems, moods, emotional changes. It can be related to depression. And we have to realize that these women get caught up and they end up in this little rut and they can't get out of it, and they're beating themselves up. It's not their fault. It's because their chemistry is messed up. If we fix their chemistry, a lot of the symptoms and things are going to actually go away. But I think they need to educate themselves, read the study, look at the results that were in there, look at the things and say, is there a different way or a better or healthier way? And there are alternatives out there.
Let's ask this question. How do you feel about mammograms?
Well, we have to realize that, you know, mammograms are a needed tool to diagnose breast cancer. But again, we have to look on the other side of the coin and say, well, what is a mammogram? A mammogram is a technique where you receive radiation so that you can determine what's going on in the breast tissue. But we have to realize that recently there was this, I believe, and don't quote me on this, but it was the American Family Physicians, I believe it was, who actually came out and said that mammograms may be linked to actually breast cancer, because we have to look at it. You know that a mammogram that gives out radiation, and this is a cumulative, and it doesn't go away. And realistically, what we want to look at is this, is that a chest x-ray gives you about 16 millirads of radiation. And a mammogram gives you 341 millirads of radiation. That's like 20 chest x-rays a year. And so we have to look at the mammogram, and I know that a lot of oncologists and other people will be irate. Well, how can a doctor sit on TV and talk that a mammogram's not good? Well, it is good, but there's other techniques out there, since we're talking about alternative. Talk about thermographies, where they can measure the change in heat in your breast tissue. And if you have a breast proliferation, or if you get cells rapidly dividing and multiplying, which happens in a tumor situation, it's going to cause a heat change. So a thermography can check for those. Is it a true test for breast cancer? No. Is it a diagnostic test? Can it give you a clinical picture of what's going on? Absolutely. There's a lot of women who go out there and have mammograms, and then breast cancer doesn't show up neither. So, you know, it's just a more conservative way of checking it. I'm not saying by any means that someone shouldn't get a mammogram periodically, but I don't know if I would recommend them to get one every year. I would not recommend that to my sisters.
An interesting perspective from Dr. Unger. And again, this show is about perspectives of alternative medicine. Quick answer. Should women feel comfortable with going on hormone replacement therapy when experiencing the onset of menopause or not?
Well, it all depends what type of hormone therapy they're going on. If they're going on hormone replacement therapy from Premarin or progestins, I don't recommend that, because you can balance out the body naturally. So why be at risk for all these side effects that we know are out there, because they halted the study like 2.5 years more than previously before it was going to end. So, you know, when we talk about hormone therapy, there are other things. We, from a functional standpoint, alternative standpoint, is if they don't have enough progesterone, why don't we help nourish the adrenal glands? Because as you go into menopause, the adrenal glands are what responsible for producing the progesterone. So why don't we balance the body out naturally? And that way there's not a lot of side effects that come along with it. So, you know, they should have some concern if they're going to go on Premarin, unopposed estrogen. I think they should have some real concerns about that, and they need to educate themselves about it.
What are the symptoms that a female might experience if she does not have enough estrogen, or she's, you know, deficient in estrogen? How would a woman know that?
Well, the problem is this, is that when you're dealing with hormones, we have estrogen and we have progesterone, the two major ones. We'll talk about those. And what happens is this, is that a lot of times, you know, you might have too much estrogen, not enough progesterone. You might have too much progesterone, not enough estrogen. So these symptoms can actually overlap. When you're in estrogen excess, you might have the heavy menstrual cycles, the heavy bleeding, you might get some vaginal dryness. And progesterone, a lot of times you're just going to get the opposites of that. So we have to realize that these things need to be in a ratio in the body together. As I said, when you go into menopause, the hormones are relatively constant throughout the month, but the progesterone and estrogen have to be relatively constant to one another, because if one is much higher than the other, then you're going to get all these symptoms of the heavy bleeding, the irregular menstrual cycles, the clotting, the cramping, all the things that go along with it. And if you're a cycling female, you might have those every month.
As women age, they experience menopause. Isn't there a corollary of that for men called andropause?
Yes, there is. Andropause is just men basically going into menopause. And in andropause, what happens, and the reason we don't talk about it or hear much about it, is that andropause happens much, much slower than female hormones. When I say much slower, is the hormones actually decline at a much slower rate. Like when you get in your 40s, testosterone will only decline 1 to 2% a year. If you have other diseases, it could be 2 to 3% a year. Whereas women, they have these hormones that go up and then they come down throughout their cycle. And what happens is that there's a big drop in them. And when you have this big drop in hormones, of course, they come along sometimes with a host of symptoms. And so females have more symptoms. So we hear more about menopause. But in all reality, men who are in andropause, the first thing, the testosterone starts going down. They start to lose their vision, starts to change, and they start to get the little pouch around their waist, because basically testosterone levels actually start to put you in the phase of insulin resistance.